Hi, I am very happy to meet you all once again. Today, I am going to present a new topic called Principles of Homeopathic Prescription. The prescription is one of the most important therapeutic transactions between physician and patient. Commonly, the term prescription is used to mean an order to take certain medications. A prescription is defined as a healthcare program implemented by a physician in the form of instruction that govern the plan of care for an individual patient. Prescription writing is a crucial task and suggests the prescriber's responsibility towards the clinical care and safe monitoring of the patient, thus also carry legal implications. It is a written order for the medication to be used for diagnosis, prevention, and treatment of a specific patient directed by a physician. The art of prescription writing is an ancient in origin and had complex prescriptions which were in Latin. Recently, it is being greatly replaced by English, and the contemporary practice are more simplified and systematic. The prescription symbol / across R currently in use is an ancient symbol that was established centuries ago. It signifies the specific Latin verb recipe of the medication and the direction for taking it. Many historic stories are associated with a prescription symbol which note its similarity to the eyes of Horus or the symbol of Zeus or for Jupiter and to various gods. The word prescription is derived from the Latin word prescriptio, where the pre means before and the scriptio means write. The word prescription from pre, which means before, and script, which means writing or written, denotes that it is an order that must be written down before or for the preparation and administration of a drug. Now let us see the definition of prescription. Prescription is a written direction given by a physician to his compounder or any pharmacist for the preparation of medicine, as well as the instruction to the patient about the mode of intake. The physician may choose to dispense the medication himself, where he needs to record the details of the prescription in his case record, along with the name, address, and age of the patient and the prescribed remedy with the potency and dose. If the physician wants to serve a prescription to his compounder or any other pharmacist, then he should properly write a prescription. It is a valuable document and must be properly written and must be preserved by the pharmacist, compounder, or the patient after it has been served. Now, let us see how to write a prescription. Writing a prescription is both a science and an art. The medical prescription is a legal written document assigned by a registered medical physician to the dispenser to dispense the selected medicine in the instructed dose, mode of intake for the particular patient at a particular time. The prescription must be written in a definite pattern. A prescription has various parts. The body of the prescription may be divided into 4 parts, that is, superscription, inscription, subscription, and signature. Prescription writing may be either in a simple form or in Latin form. A simple form of prescription is generally used. It should be legible, accurate, and reliable. The first division of a prescription is superscription. It is the heading. The word for may be written at first. Below the word for, name, age, sex, address of the patient must be written on the prescription. The patient's full name must be written instead of surname or family name. The age and sex of the patient, especially in the case of children, help the pharmacist to checking the medication and the dose. Therefore, there will be less danger of its being administered to the wrong members of the family or hospital ward having similar names. The address of the patient is recorded to help for any reference at a later stage to contact the patient or to deliver the medication personally. The superscription is represented by symbol R with oblique slash, which is always written at the beginning of the prescription. In the day of mythology and superstition, the symbol was considered as a prayer to Jupiter, the god of healing, for quick recovery of the patient. But now this symbol is understood as an abbreviation of the Latin word recipe, meaning take thou or you take. It includes the patient's name, address, age, date of birth, date of admission, weight, and the date of prescription writing, and the prescription symbol R with oblique slash. Name and address of the patient written below the symbol R with oblique slash. Age and sex are written below the name and address. The second division of the prescription is inscription. It is the body of prescription. This part forms the main part of the prescription. It is written just below the right to superscription. It consists of name of medicine with the potency, quantity ordered, and the vehicle or diluent. The vehicle is either used to dissolve the solid substance or to increase the volume of prescription for ease of administration. The third division of the prescription is subscription. It should be written in line below the inscription. This part of the contains the prescriber's direction to the pharmacist regarding the dosage form to be prepared and the number of doses to be dispensed. And the fourth division of the prescription is signature. It includes a prescriber's direction for the patient, signatura from the Latin signa meaning write or make or label. It should be always written in English. The use of abbreviations or symbols should be discouraged. The instruction should be short, simple, and to the point. It includes route or methods of administration, number of dose forms, for example, 1 or 2 tablets, how to use the medicine, that is, route of administration and the time of intake of medicine, frequency of administration, or dosing intervals should be mentioned. Instead of every 6 hours or 3 times daily, etc., the exact schedule should be given. For example, as 8 am, 12 pm, 6 pm, etc. Next, write follow-up instruction, that is, when to come for a second visit. And lastly, write any advice regarding diet, any precautions, lab examinations, etc. And finally, put the signature, address, and registration number of the prescriber. All other parts of the prescription may be in printed form or in a typewritten form, but the prescriber's name must be handwritten and should be signed with an ink pen. This eliminates the danger of dispensing medicaments on a spurious order and it authenticates the prescription. While writing a prescription, you should observe the following points. Begin each line with a capital letter. Write the name of the medicine first and then the vehicle. Use Latin name for the medicine. Directions to dispenser should be in Latin. The direction to the patient should be given in common language. The dispenser must also write the direction on the label of the medicine either in English or in the vernacular language of the place. When in doubt, make sure to always write in English. The dispenser must understand the meaning of the expression used. Read the prescription once before handing it over. That's all about principles of prescription writing. The formats or examples of prescriptions and common abbreviation used to write the prescriptions are given in the description. Please go through it and learn well. Thank you for watching. See you in the next session. Bye.
Thanks for watching.
Like,
Comments. share,
and
subscribe.